Mr. Speaker, I would ask my colleagues a very simple question. Can this Congress approve legislation that is supported by over 85% of the American public, that is truly bipartisan legislation with distinguished Republican co-sponsors, and will not cost anything, in fact, could even save billions of dollars? Can we give the American public something they not only want, but they need and to which they're entitled? I would hope so. I would hope that Congress could act on the Personalize Your Care Act, H.R. 1173, which I've introduced along with Dr. Rowe, Mr. Reed, Mr. Hanna, Drs. McDermott and Barra. I would make part of the record survey research by the Regents Foundation and the National Journal that shows overwhelming public support for this type of protection for families. 96% of Americans surveyed said it was important that these health and end-of-life issues be a top priority for our healthcare system. 97% agree that it's important that patients and their families be educated about palliative care and end-of-life option treatments available, along with curative treatment. And 86% agree that these discussions about palliative care and end-of-life treatment should be fully covered by health insurance. Americans agree that people need to know what faces them in difficult situations approaching end of life, or when people are temporarily unable to make medical decisions for themselves. But Medicare, which will pay tens of thousands of dollars for a full hip replacement for a 93-year-old woman with terminal cancer, will not authorize a couple $100 for her and her family to have medical consultation about her personal choices and circumstances for the future. Our legislation will change that. There have been fascinating studies about how doctors die differently from the rest of us because they know what works and what doesn't. Doctors, it turns out, tend to consume health care much differently and often less in their final year of life. It's not that they don't understand. It's not that they don't have access to health care. They can't afford it. They just know their situation better than the rest of us. They know what works, and they know what they want. And usually that means comfort and quality of life and more control. Our legislation will be a small but important step to make sure that every American is treated like a doctor in their last year of life, knowing their choices, knowing their prospects, being able to identify what they want, and make sure that their wishes are known and respected. Now, I don't think there's any of us on the floor of the House who has not felt some frustration. Can't we get something done? Well, here's an opportunity that doesn't depend upon what your view of Obamacare is. Whether it's implemented, delayed, or repealed doesn't matter. This is legislation that doesn't need to cost anything. It actually will end up saving money, but money is not the point. Can we act together to do something for the public, show that we're not paralyzed, that we can work together, that we can make progress in a difficult environment? I would urge my colleagues to join the bipartisan and growing list of members who have co-sponsored the Personalize Your Care Act, H.R. 1173. Someday, Congress is going to deal with the vast looming crises we face. In the meantime, helping patients understand their choices, make their wishes known and respected, is an important step to start. Thank you very much.